oh my goodness, we are wasting hundreds and hundreds of millions of dollars every single year.
So when it comes to the cost savings, or I would even say the strategy on having patients be able to benefit from something like this, to get it all the first time, to not have to wait, to not have to stress about it, would there be, or is there an implication on how this technology can help economically, which downstream means hopefully, a reduction in this rising cost of healthcare, insurance, getting insurance, the bills that we get? How does this play into the economics of the healthcare system as a whole?
There was a study that was published maybe a little bit more than a year ago, put up by a few researchers from MD Anderson, which was an economic study. So it was pretty broad-based. It was looked at several years worth of both Medicare and commercial payers for breast cancer, thousands and thousands of records. And looked at, okay, what is the cost? The extra cost of all of these re-excisions that are happening across the country. And when you kind of go through the math, you crunch everything, for every re-excision is somewhere like up to $25,000 to $30,000 for a second, surgery. Not including, and now if you have to flip over to a mastectomy, now you're talking, tens and tens of thousands, 50, maybe close to 100,000 extra dollars for that, flipping over to a mastectomy. So yeah, as humans, we think a lot about the emotional response, and as surgeons, I'm not a surgeon, but I can just imagine what it feels like to want to help someone to do a job, and then unfortunately it doesn't work out the way you hope for. Like that's got to take a toll on you as a provider. But then if you look at it from as an economic animal, then you look at it, it's like, oh my goodness, we are wasting hundreds and hundreds of millions of dollars every single year due to this. And that's terrible. And probably the most egregious part is, what you said is if you leave the cancer there and it continues to grow for 3 or 4 more weeks, 5-year survival rates go down, right? And for breast cancer, they go down some amount. If the first surgery was successful or not. But other cancer types, it goes down quite a bit, actually.
Oh my gosh, like progressive pancreatics and things that I can't imagine would be very, timely.
So the economics, and you're right, bang on the money, right? So who cares about the economics? It's the payers, right? The insurance companies that really care about this. And so part of our job is also to gather that data, which we've started to do, and present to them and say, hey, look, not only is this in the best interest of the patients from just a human level, but it's also in your economic best interest because, by the way, you're paying for these second surgeries, and you can't want to be doing that. And not only is that direct cost there, but if that operating room is occupied by doing that second surgery, then that operating room becomes a scarce resource. And if you've got more supply, less supply and more demand on that scarce resource, the price of that operating goes up. So what knock-on effect is having across everything else you're paying for because there just aren't enough operating rooms? So there's direct cost. And then there's all the indirect costs. So, that is starting to resonate we've started those conversations, but it resonates. It doesn't take a complicated logical leap to go from what we can solve to the ability to save money in the system. And if you go through that analysis, it's hundreds and hundreds of millions of dollars. You can not even bring re-excision rates down to zero, but just cut it by 50%, 75%. It's a ton of money you can put back into the system.